Okay, I'm going to do an intradermal injection, and I'm going to first go over the 6 rights of medication, which is right patient, right dose, right drug, right time, right route, and right documentation. And I would also wash my hands, and then I would get all my equipment together, which I am going to get a needle. It is a 27 gauge, ½ inch, 1 milliliter, and then my medication. I would also check the MAR, and I would check the orders, make sure it's the right med. As I look at the vial, I am making sure there's no cracks, and I'm checking the expiration, and I'd also check if it's a multi-use, the nurse, and the time and date. Okay, so first I am going to clean off the top with an alcohol prep pad. This would go in the trash. And then I'd get my needle ready. Okay, so first I'd uncap, clean, leave that on a clean surface. I'm going to draw up air. I'm going to do 0.5 so it doesn't explode out of my skin over here. Oh, sorry, 0.05. Okay, I drew up the air, and now I'm going to inject it into the vial. 45 to 90, inject your air. I'm going to flip it upside down, and then I'm going to draw up my medication, the 0.05. Perfect. Okay, and then I'm going to flick it, make sure all the bubbles are out. Okay, withdraw. And then I'm going to safely recap. Here, let me move this out of our way. It is a one-handed technique. Scoop, secure. Okay, I have my medication ready. Let me grab my patient. So I went to their room. I'm just going to wash my hands because that's what I do when I go into somebody's room. And I am going to ask them their 2 identifiers, name and date of birth. That was right. I'm going to explain the procedure to them. I'm going to tell them that I am doing an intradermal. It is going to go here on the underside of their arm. I'm going to inject a small little bit of fluid into their arm, and it's to check for TB. Okay, and then I am also going to check their allergies again, and I'm going to check the dose, and I'm going to make sure it's the right time and the right route. Okay, I'm going to put on gloves. I have gloves, yes, but they're seriously so big it's hard for me to put them on. So I have gloves on. First I'm going to clean the area, and I circle from in to out. Perfect. Trash. And while that's drying, I'm going to uncap safely my needle. I'm going to check and make sure the bevel is up. And then I'm going to pull the skin taut, bevel up, injecting at a 5 to 15 degree. It is 1/8 in. I'm going to slowly inject the medication, withdraw the needle, and then this would go into a sharps container. I would not recap it, but seeing as I don't have one, I'm going to recap it. Perfect. And I don't know if you guys can see it, but there's my little buddy. Okay, and then I would dab any blood if there was blood with gauze, but there's no blood here. And then I'm going to draw a circle around it. I just don't want to draw my buddy, but I draw a 1-inch circle around it. Then I explain to the patient that they need to come back in 48 hours or go see another nurse in 48 hours to have it checked. And then I'd make sure they were comfortable, had their call light, all that good stuff. I'd leave the room and I'd go document on the MAR as well as in the nurse's notes. And that's it.